So Dawn, why don't you tell us a little bit about what brought you in to see your physician?
Well, a few years ago, I experienced some irregular patterns of bleeding and noticed some abnormal feelings on my abdomen of something wasn't right as far as a hard feeling on the surface. So I decided I needed some help because these conditions were impacting my ability to have an active lifestyle that I've been used to. So I thought I would seek physician's advice.
And when you saw your physician, what was the diagnosis and what were the options that were given to you for treatment?
Well, the initial diagnosis was, well, you're going through premenopausal syndromes and they'll go away. And then blood tests were performed to check hormone levels, and from my understanding, those can change at any given time. So there was no initial diagnosis that I was satisfied with.
And that led you then to get a second opinion, or did you go and ask friends, or how did you then find the surgeon who ultimately performed your procedure?
Well, I continued to ask questions of my physician and finally convinced him to run additional tests to understand really what was going on internally. And he did so, ran an ultrasound, and diagnosed that I had uterine fibroids. And at that point, he gave me his opinion on what treatment modalities he recommended for me.
And what was that?
His initial recommendation was that of an abdominal hysterectomy, and he highly encouraged me to also consider having, my cervix removed from a preventative measures.
So when you were faced with this news, did your physician offer you any alternative treatments for your condition?
At the time, he offered me the opportunity to go home, think about it, do some research, and advise me about minimally invasive procedures that I could take into consideration. One of the most important things to me was that the procedure addressed my condition, that it didn't take into consideration any potential conditions or symptoms that I may have in the future. And another important aspect of my research was that I wanted to make sure that cosmetically that there would be limited impact, if any, on my body, because it's important to me to maintain an active lifestyle and be out of my routine for a short period of time.
And how did you get information?
Mainly the internet, a great resource, a vehicle for this type of information. I did talk to friends, but their experiences were a little different, where they would take the advice of their physician, and a lot of them did not understand that they did have options to consider, and there are lots of options out there.
And at this time, had you ever heard of laparoscopic supracervical hysterectomy, or was this a new term for you?
This was a new term for me. I was a happy, healthy, active individual. I didn't keep up on these modern treatment modalities for females because I didn't think it would happen to me. Mm-hmm.
So once you found the name of this surgeon, how did you verify that this surgeon is going to meet your needs as an experienced surgeon?
Well, I started by contacting my primary physician to get his recommendation about the physician that I identified who practices minimally invasive surgery. And he acknowledged that the individual was well known in the community as well as has been practicing this procedure for a period of time. Once I identified the individual that I wanted to perform the procedure, it was important to me that the individual just address my current condition and not try and talk me into a procedure in it for preventative purposes, and that the individual also was willing to stick with me during the procedure, that I know there's always a risk that the procedure might not go as well, or the minimally invasive surgery might not be the right thing to do once the individual started the procedure.
Tell us a little bit about your short-term recovery, and that is, what kind of discomfort did you experience? How long was it before you felt like you were pretty much back to your normal activities?
Well, immediately upon coming home, I found that I was okay using ibuprofen instead of a prescribed pain medication, since the pain was minimal in my experience. Just a couple days after surgery, I was up and walking around my house and decided on day 3 I was ready to go out for my walk. I'm an avid runner and felt that it was important to get out and walk that first mile with pillow in hand just in case I needed that extra comfort.
When did you go back to work, and when was it that you felt that you were pretty much back to your normal activity?
Well, I felt well enough to go back to work after the first week, and I also started a regular exercise routine again after the first week.
So, Dawn, it sounds like you've had a pretty good experience with your procedure. What can you tell women if they have been told they need a hysterectomy or they're faced with needing a hysterectomy? What are some of the things that they need to consider, and what are some of the things that they need to do to help them make the decision that's right for them?
Well, first, I think women need to understand what their options are. And then once you understand what options are available to you to treat your condition, I think it's important for women to take a look at what do they value, what is important to you as an individual in determining what treatment modality is best for you.
So patient education is very important to you, and it should be to all women. If your physician doesn't give you a lot of options or doesn't know what other options are available, what are some other resources that women might have to find out about these?
Well, in my opinion, the best resource is the Internet. And the second best resource would be friends, acquaintances who may have experienced similar conditions in their life.
Anything that you would like to say that we haven't talked about, a message that you want to get out?
Well, I think all women have some loyalty to their physician, and that's important to me, and I understand the importance to other women. However, as I said earlier, it is all about options. And unless you research and better understand what those options are, you might miss out on an opportunity to better meet your needs regardless of that loyal relationship you have with your physician.